The discovery of antibiotics revolutionized medicine. These wonder drugs conquered bacterial infections, saving countless lives. However, a new threat has emerged: superbugs. Superbugs are bacteria that have evolved resistance to our most powerful antibiotics. They pose a significant threat to global health. We must understand the causes of antibiotic resistance and take immediate action. The discovery of penicillin in 1928 marked a turning point in human history. For the first time, we had a weapon against deadly bacterial infections. Antibiotics quickly became a cornerstone of modern medicine, saving millions of lives. They made complex surgeries and organ transplants possible, revolutionizing healthcare. The impact of antibiotics extended beyond treating infections. They became essential in preventing infections in vulnerable patients, such as those undergoing chemotherapy or organ transplantation. Antibiotics enabled significant advancements in medical procedures and public health, dramatically increasing life expectancy and improving quality of life worldwide. Bacteria, like all living organisms, are constantly evolving to survive. When exposed to antibiotics, most bacteria die. However, some may possess mutations that make them resistant to the drug. These resistant bacteria survive and multiply, passing on their resistance genes to their offspring. Over time, the overuse and misuse of antibiotics create an environment where resistant bacteria thrive. This leads to the emergence of superbugs, resistant to multiple antibiotics and increasingly difficult to treat. The consequences of superbug infections are severe, leading to longer hospital stays, higher healthcare costs, and increased mortality rates. The World Health Organization identifies antibiotic resistance as a major threat to global health, food security, and development. An estimated 700,000 people die each year from drug-resistant infections. Without effective antibiotics, we face untreatable infections. Superbugs affect healthcare and agriculture, where antibiotics are used in livestock. This spreads resistant bacteria, risking human and animal health. A global, multi-sectoral approach is needed to preserve these life-saving drugs. Section 5. The roots of resistance. Antibiotic resistance is a natural phenomenon. Human actions have accelerated the process. Overuse and misuse of antibiotics drive resistance, often prescribed unnecessarily for viral infections. Inappropriate use in agriculture also contributes. Resistant bacteria spread through food and environment. Addressing misuse is crucial to curb superbugs. Section 6. The dwindling arsenal. The development of new antibiotics has slowed dramatically in recent decades. Pharmaceutical companies face significant challenges in developing new antibiotics, including high research and development costs and relatively low returns on investment. The lack of new antibiotics in the pipeline is a major concern. As superbugs continue to emerge and spread, our arsenal of effective antibiotics is dwindling. This situation underscores the urgent need for investments in antibiotic research and development to address this growing global health crisis. Section 7. Seeking new weapons. While developing new antibiotics remains crucial, researchers are exploring alternative approaches to combat antibiotic-resistant bacteria. Bacteriophages, viruses that infect and kill specific bacteria, are a promising avenue. Other alternative approaches include antimicrobial peptides, nanoparticles, and therapies that target bacterial virulence factors rather than killing the bacteria directly. These innovative strategies offer hope for combating superbugs and preserving the effectiveness of existing antibiotics. Section 8. Prevention, our first line of defense. Preventing infections in the first place is the most effective way to combat antibiotic resistance. Simple measures like hand washing, vaccination, and safe food handling practices can significantly reduce the spread of infections. Furthermore, responsible antibiotic use is crucial. This includes taking antibiotics only when prescribed by a healthcare professional, completing the full course of treatment, and avoiding self-medication. Public education campaigns can raise awareness about the importance of these measures in slowing the spread of superbugs. Section 9. A call to action, preserving the miracle. The rise of superbugs is a global health crisis. We must act to preserve antibiotics for future generations. This requires a multi-pronged approach. Invest in new antibiotics and alternative therapies. Strengthen infection control, promote responsible use, and raise awareness. Together we can combat superbugs and preserve antibiotics.